If you are losing erections, and you have been blaming stress, or age, or how attracted you are to your partner, your body may be sending you a cardiovascular warning. That has nothing to do with any of those things. Erectile function is a vascular event. An erection requires rapid, high-volume blood flow into the corpus cavernosum, two cylindrical chambers running the length of the penile shaft. That flow is regulated by the endothelium, which releases nitric oxide to signal smooth muscle relaxation and vasodilation. When the endothelium is damaged or inflamed, that signal weakens. Here is the clinical fact that changes everything. Penile arteries are 1 to 2 millimeters in diameter. Coronary arteries are 3 to 4 millimeters. Endothelial dysfunction shows up in the smallest vessels first. Research models consistently show that erectile dysfunction precedes major cardiac events by 3 to 5 years. ED is not the problem. ED is the warning system. This reframe is not meant to frighten you. It is meant to hand you back your agency. Because the man who walks into a doctor's office about erectile dysfunction, if that doctor is asking the right questions, is the man who gets a lipid panel, a blood pressure check, a fasting glucose, and an early cardiovascular risk assessment. He is the man who catches atherosclerosis before it becomes a heart attack. The man who stays silent, who manages it privately, who blames his psychology, who waits, loses that window. Did you know that ED in a man under 50 carries a 3-fold increased risk of future cardiac events compared to men without ED? That statistic is not a sentence. It is a referral. Your body built you an early warning system. The courageous act is walking through the door and using it. Your one action: book a GP or primary care appointment this week. When you sit down, say this: I've been experiencing erectile dysfunction, and I'd like a cardiovascular risk screen, lipid panel, fasting glucose, blood pressure, and BMI baseline. Do not let this appointment end with a prescription for sildenafil and no blood work. The medication manages the symptom. The blood work investigates the cause. You deserve both. Save this. Share it with the man in your life who has gone quiet about this. Because what looks like a bedroom problem might be the most important medical appointment he never knew he needed.